Senator Barrasso, who is our next guest. He says he hopes President-elect Trump will focus on appointing a Health and Human Services Secretary as a top priority, and then you could get started on day one amending the health care law immediately after inauguration. Joining us now, Wyoming Senator and Dr. John Barrasso. And that's one way of looking at it. So repeal takes time, it's legislative, but if you had an HHS secretary ready to go on that day, what would he be able to do in terms of modifying the rules and regulations that are in place right now, Senator? That's your idea?
Well, thanks so much for having me, Joe. Obamacare is over. And on day one, there's some things you can do with the pen and the phone, and then you have to bring in the sledgehammer to completely repeal Obamacare. Things you could do with the Secretary of Health and Human Service immediately is provide relief for many of the people who are suffering under the mandates and the businesses that are holding back hiring because of the mandates. So you can do things immediately. You would stop the illegal payments that are going out from the government with a lawsuit that the House has brought against the Obama administration. President Trump can stop that lawsuit from being defended. So you can do things in terms of making sure that new people sign on. The administration right now is desperately trying to get more people to sign up for a program that is costly, complicated, and collapsing. And President Trump can stop that effort as well. Plus, you just give a lot more authority back to the states.
That's what you're saying. What would you make a big point about something that you would reverse for what states have to do right now? Could you explain that and how would it work?
Well, you want to give states freedom and flexibility and choice. You want to get this away from being a government-centered health care program to a patient-centered health care approach to actually lower the cost of care. But you could do it with Medicaid, giving states more authority there, letting states decide what kind of insurance can be sold in their states so that people can decide what they want to buy, something that they think is right for them and their family, as opposed to something President Obama says they have to have. That alone will provide more competition and will lower the cost. There are lots of things that can be done in a positive way. President-elect Trump talked about 26-year-olds staying on their family's plan. I think Andrew wrote about it this morning in the New York Times in his article, A New Game. And President Trump, basically, President-elect Trump tells the truth about it. He said it's a good idea, but there's a cost to doing it. What President Obama, the Democrats used to say is, and it's free. Well, it's not free. There's a cost to these things, even if it's a good idea.
Well, those were both Republican ideas before Obamacare. It could have been done if Rahm had probably stayed and you had a bipartisan approach to it instead of what actually happened. So it's not a surprise that Trump would keep those. Who has President-elect Trump's ear right now? Do you have it? Does Ben Carson have it? Do you both talk about this? And when you say sledgehammer, I can just tell you that the left is thinking 21 million people thrown out on the street that have insurance now and didn't have it before. That's what they're thinking when you say sledgehammer. And a kinder, gentler Donald Trump that we've seen, he's going to be susceptible, I think, to that argument. Or could be. I don't know. I don't know how he will be. But do you know?
We're working with a new administration. We had a meeting actually the day that the exchanges opened, November 1st. Donald Trump, Mike Pence were both in Valley Forge. The Senate doctor, as well as House doctors, the doctor congressional group was there with him. Ben Carson was there, all talking about health care and ways we can do this in a way to help lower the cost of care, to help take care of patients, so that the President Obama always talks about coverage. We're actually talking about health care. So we're working together to do this. Yeah, I expect the Democrats to do the kind of scare tactics that they're used to doing. But I think we can do a much better job in terms of focusing on the cost of care, which was what this was all about in the beginning. As you just said, Joe, 6 years ago, things weren't perfect for patients or for the providers of health care. We had to do a lot of work. We want a smooth transition, and Mike Pence has talked about that, a smooth transition for people right now who are under Obamacare. Their lives have been disrupted enough by this administration. We need to make sure there's a smooth transition.
I think people just, including me, are unclear about whether the ACA, the Affordable Care Act, whether some remnant of it will still be on the books as existing law or with modifications, or whether that will be gone completely and the remnants will then be brought back with new legislation in a completely different system. Will it be defunct, the ACA, or not?
Obamacare is over. I think the Wall Street Journal editorial this morning put it very well. Don't get fixated on some of this phraseology.
Right.
Obamacare is over. We promise to repeal and replace it. That's what we're going to do.
Okay, Senator, thank you.